Hello and welcome. Today we'll be discussing pyelonephritis, a common and potentially serious infection of the kidneys. Understanding what it is, how it develops, and how it's treated is crucial for maintaining kidney health and overall well-being. Pyelonephritis is typically caused by bacteria that travel up the urinary tract from the bladder to the kidneys. The most common culprit is Escherichia coli, or E. coli, which is often found in the gastrointestinal tract. Other bacteria, such as Klebsiella, Proteus, Enterobacter, and Pseudomonas, can also cause pyelonephritis, especially in individuals with underlying health conditions or those who have undergone urinary tract procedures. Less commonly, the infection can spread to the kidneys through the bloodstream. Factors that increase the risk of developing pyelonephritis include urinary tract obstructions like kidney stones, vesicorectal reflux, a condition where urine flows backwards from the bladder to the kidneys, pregnancy, catheterization, and conditions that weaken the immune system, such as diabetes or V. Let's delve into the pathophysiology, or how the infection actually damages the kidneys. It begins with bacteria ascending from the lower urinary tract, colonizing the renal pelvis, the funnel-shaped structure that collects urine from the kidneys. These bacteria then invade the kidney tissue, causing inflammation and the formation of abscesses, or pockets of pus. This inflammatory response damages the renal tubules, which are responsible for filtering waste and reabsorbing essential substances. The infection can also lead to scarring of the kidney tissue, which over time can impair kidney function. In severe cases, pyelonephritis can progress to sepsis, a life-threatening bloodstream infection. Pyelonephritis is a fairly common urinary tract infection. While exact prevalence figures vary, it's estimated that around 1 to 2% of adults will experience pyelonephritis in their lifetime. Women are more susceptible than men due to their shorter urethra, which makes it easier for bacteria to reach the bladder and then ascend to the kidneys. People with underlying medical conditions that affect the urinary tract or immune system are also at higher risk. Children, particularly young girls, are another vulnerable group due to anatomical differences and hygiene practices. The symptoms of pyelonephritis can vary in severity, but often include fever, chills, and flank pain in the side or back. Other common symptoms are nausea, vomiting, and dysuria or painful urination. Patients may also experience increased urinary frequency, urgency, and hematuria, which is blood in the urine. Sometimes pyelonephritis can cause systemic symptoms such as fatigue, malaise, and altered mental status, especially in older adults. In children, symptoms can be less specific and may include irritability, poor feeding, and unexplained fever. Diagnosing pyelonephritis typically involves a combination of medical history, physical examination, and laboratory tests. A urine sample is usually collected to check for the presence of bacteria, white blood cells, and red blood cells. A urine culture may also be performed to identify the specific bacteria causing the infection and determine the most effective antibiotics. Blood tests, such as a complete blood count and blood cultures, can help assess the severity of the infection and rule out sepsis. In some cases, imaging studies like a CT scan or ultrasound may be needed to detect kidney stones, abscesses, or other abnormalities that could be contributing to the infection. Pyelonephritis can be classified as either acute or chronic. Acute pyelonephritis refers to a sudden and severe infection that develops over a short period of time. Chronic pyelonephritis, on the other hand, is a persistent or recurrent infection that can lead to progressive scarring and damage to the kidneys. It often results from underlying abnormalities or repeated episodes of acute pyelonephritis. Treatment for pyelonephritis primarily involves antibiotics to kill the bacteria causing the infection. The specific antibiotic used will depend on the bacteria identified in the urine culture and its sensitivity to different medications. Oral antibiotics are typically effective for mild to moderate cases, while intravenous antibiotics may be necessary for more severe infections or those that require hospitalization. Pain relievers can help manage discomfort, and fluids are important to stay hydrated and help flush out the infection. In cases of kidney stones or other urinary tract obstructions, surgery may be needed to remove the obstruction and allow urine to flow freely. Preventing pyelonephritis involves reducing the risk of urinary tract infections in general. This includes drinking plenty of fluids to stay hydrated, practicing good hygiene by wiping from front to back after using the toilet, urinating after sexual activity, and avoiding holding urine for long periods of time. For women prone to UTIs, cranberry products may help prevent infections by preventing bacteria from adhering to the urinary tract walls. Treating underlying conditions that increase the risk of pyelonephritis, such as kidney stones or vesicorectal reflux, can also help prevent future infections. The prognosis for pyelonephritis is generally good with prompt and appropriate treatment. Most people recover fully without any long-term complications. However, if left untreated or if the infection is severe, pyelonephritis can lead to serious complications such as kidney scarring, chronic kidney disease, high blood pressure, and sepsis. Researchers are continuously working to develop new and improved diagnostic and treatment strategies for pyelonephritis, including more effective antibiotics and preventive measures. Current research also focuses on understanding the long-term effects of pyelonephritis on kidney function and overall health.